my point is the people that end up coming out to see me are a lot of times the people who had hard-flaccid and pelvic pain. The pelvic pain's resolved in a lot of these cases, and the hard-flaccid has lingered. And what Rocco and I have been studying is, and we have some slides we're going to show you, but is the Buck's fascia, which is the connective tissue that basically makes up the shape of the penis and engorges with blood. And we'll get to those pictures in a second. But what I've discovered from working with a lot of these different patients is that there are pretty much two different mechanisms of injury that cause hard-flaccid specifically. And the first one is an actual direct injury to the Buck's fascia, meaning when there's a sexual accident and you miss your mark and actually break your penis. That's a direct injury to the fascia inside the penis. And what that means is that it's a lot like a high hamstring strain, where you tear a little bit of the tendon off the top of the hamstring where it attaches to the underneath your butt. It's a very insidious injury because of the fact that every time you sit down and then go to stand up, you re-tear that tendon away from the bone, and then the inflammatory response starts again. And it can take up to 18 months for that to heal, just because you can never not injure it. So with an injury to the Buck's fascia directly, every time you get aroused and get an erection, you're literally straining the Buck's fascia where the injury occurred, which exacerbates, obviously causes pain, but it exacerbates spasms in the pelvic floor the same way that our theory about active insufficiency and the large muscles collapsing the pelvis would do. So there's a couple, I guess the secondary mechanism of injury, which is a little more unique and can be a lot more challenging, is that the way in which the Buck's fascia integrates into the lower abdominals and then into the pelvic floor itself, it can actually, if it's a strong enough injury or contraction or spasm, the Buck's fascia can peel and injure one of the pelvic floor muscle attachments, like the levator ani or any of the other muscles. And so then you actually truly have a situation that's almost exactly like the hamstring strain, where every time you get aroused, it re-injures a pelvic floor muscle and sends the entire pelvic floor into spasm.
Well, and I want to bring up, it's not just you breaking the penis, okay? Because there's a lot of people out there that are going to be talking, that are going to be, well, I never broke my penis. Well, you know, aggressive masturbation does extreme damage to the Buck's fascia. You know, that jelqing, and I'm very opposed to people jelqing for so many different reasons, but jelqing can cause injury, and we have to understand that things that happen with pelvic pain and with the hard-flaccid, they are injuries, and they have to be treated like an injury. And if you don't, if you listen to the doctors, if you listen to the physical therapists, and you resolve yourself to thinking that this is a condition, right, you will never understand, and you'll never get that that we can resolve this. And you can get full of recovery, because it's not a condition. It's an actual injury that you've done, that you've perpetrated on your penis. And so we have to make sure that that understanding is drilled into your head as a sufferer of hard-flaccid, as well as the medical community. You've injured something, and it's not it's an inflammation response.
Yeah, which becomes a chronic inflammation response, which then becomes a stress reaction. So even if there's a minor stimulus, it causes a major flare up.
Well, and we're seeing that that many people not just getting arousal, like sexual arousal when you're with a partner, but the nocturnal stuff. If you wake up with a hard on, or if you're, we're seeing that is very, very damaging to people, and it's re-tearing. So
yeah. And another thing about excessive masturbation is the buccal fascia has nerves running through it, and so some of the people that have come to the clinic have literally overstretched the nerves that run through the buccal fascia, which is another injury. But the interesting thing, let's go ahead and pull up some of the slides, Rock. I want to show everybody the